Well, now we move to the healthcare crisis here in New Mexico. We've told you about it before. Our state is facing a horrible shortage of doctors and other medical providers.
And now hundreds of women here in the metro are facing the reality of that shortage. Women's Specialists of New Mexico, our state's largest independent women's health practice, will no longer deliver babies over at Presbyterian hospitals.
Cassie Foote talked to a doctor with the practice. So, Cassie, what does this mean for her patients?
Well, I want to be clear, the providers with Women's Specialists will still be delivering babies at Loveless Women's on Montgomery. This change is only impacting patients who plan to deliver at Presbyterian hospitals. I talked to one of those patients today. She says it's disappointing to know the doctor she has spent her entire pregnancy with will not be the one to help her bring her baby into the world.
There are a lot of things out of a pregnant woman's control.
Nervous, of course. Gonna have to figure it out as we go.
Tanique Callahan is 32 weeks along. She's getting ready to welcome her first child, a baby girl, in March.
I'm excited to be a mom and see where this journey takes me. And I'm excited for us to see where it takes us together.
Soon-to-be dad Zach Plant feels the same way.
I'm excited, nervous, but I'm really excited to be a dad too.
Callahan's OBGYN is Dr. Janine Valdez with Women's Specialists of New Mexico.
How's baby doing? Good. Moving around a lot.
Valdez has been there for Callahan throughout her pregnancy. But when it's time to deliver, the doctor she's grown to trust won't be there.
It's going to be sad, and it's unfortunate that we can't see them through the entire pregnancy, but we'll be happy to see them back afterwards and continue their care afterwards and continue that relationship.
That's because Women's Specialists is just the latest group of providers to be impacted by our state's physician shortage. The practice sent a letter to more than 200 patients last week. Starting March 1st, they'll no longer be delivering babies at Presbyterian hospitals. They will continue delivering at Loveless Women's.
Can no longer stretch our physicians to cover 2 hospitals. We have to take the well-being, both physical and mental well-being of our physicians in mind, and can't stretch them out too far.
Dr. Valdez says they have 9 physicians providing 24-hour OB coverage. They need that to double. But hiring and keeping doctors is a challenge. She cites our state's medical malpractice laws, tax policy, and Medicaid reimbursement rates as reasons. So when it comes time for Callahan to meet her baby, she'll also be meeting a new doctor.
Not being able to finish with them and having somebody familiar, somebody who knows your journey, who knows who you are personally and what your needs are. So it's a little disappointing that they won't be there.
Women's Specialists will continue to offer all outpatient care, including for patients with Presbyterian health insurance. So this includes prenatal and postpartum appointments. They are working on a process for patients delivering at Presbyterian to get to know and establish care with the providers there. Tessa, Trevor,